This was such a satisfying deep cleaning process. This process took about close to 3 hours with our patient. So, what we're doing is called a deep cleaning, or in terms of dental terminology, we call it scaling and root planing. And this device, of course, is only done in the dental office, is an ultrasonic scaler, or also known as a cavitron. And what it does is it has a frequency, it vibrates, and then it also shoots water so that we can properly remove the hard minerals that's caked on to the tooth. And if you guys are wondering why your teeth are yellow, it's because of this. So please, please do not attempt to try to bleach your teeth thinking that will resolve it. Unfortunately, that's not the case. But if you notice how the teeth are getting whiter, because once we remove all this, it does start to expose the enamel which was covered underneath. Now, you're probably also wondering, what is tartar calculus? Well, how I explain it to my patients at the office is that tartar calculus is just basically like mineral calcium deposits. Just imagine if you didn't squeegee your glass shower door on a regular basis. If you notice, it starts to form all these hard mineral deposits, and then of course you can't properly clean off the glass shower door with just like a wipe or even with Windex. Exactly. This is what that is. It represents the same situation. So, of course, over time, you're trying to brush harder and harder. It doesn't come off, but it actually attracts more buildup to form. And you can see it's just coming out in chunks. And I'll be honest, it is so satisfying to do this process. I always think a deep cleaning is like popping a pimple, honestly. That's why I love watching those pimple popper episodes and videos. But as you can see, by removing this, this is allowing the gums to properly heal. Now, I know the questions you guys do ask is, will the gums grow back or the bone? Unfortunately, it can't not grow back on its own. There is no way, since it's basically loss. And as you can see, it starts to slowly eat the gums and the bone away. Now, of course, the goal is we're trying to slow down the process and basically keep the patient now on a maintenance schedule. But a deep cleaning shouldn't really be done all the time. I always look at it, it's just like a tune-up to a car. And if you come regularly for the oil change, that's what's going to help keep it. But the goal is to keep your teeth until you die. And because that way you can actually chew, enjoy food, and just really have a great standard life of care. So, but all that stuff is coming out, and basically I can see it was having a accumulation of all of it. I'm kind of collecting here like a bone collector, but yes, please see your dentist. And if not, you guys are always welcome to hit me up. I'm always doing free virtual consultations via Zoom.